Millions of Americans could lose access to critical food assistance programs if the government shutdown continues into next month.
The Supplemental Nutrition Assistance Program, otherwise known as SNAP, as well as another assistance program for women, infants, and children are at risk of running out of money in just days. Tonight, Erie News Now Washington, D.C. correspondent Brendan Scanlon is joining us live on Capitol Hill, where, Brendan, an extremely consequential week is underway in Washington tonight. Good evening.
Hey there, Mike and Eva. Good evening to you. Yeah, very consequential to say the least. If Congress doesn't pass a spending bill or if the Trump administration doesn't find additional funds by the end of this week, then programs like SNAP and WIC are expected to run out of money by November 1st. The United States Department of Agriculture says SNAP has about $6 billion left in its contingency fund, but the total bill for November benefits is closer to $8 billion.
But in November, we are worried about losing all that money for funding.
The Supplemental Nutrition Assistance Program supports roughly 42 million Americans. WIC helps more than 6 million pregnant women, new moms, and young children buy essentials like formula and baby food. Benga Adjolore with the Center on Budget and Policy Priorities says Americans who rely on food assistance are at risk, especially in rural areas.
Upwards of 6.6 million rural residents also take SNAP. And in fact, people take SNAP at a higher rate in rural areas as opposed to metro areas.
Chances for a deal in time to provide November's benefits are fading as partisan attacks escalate.
This is purely Democrat. They're doing some really bad things. I think they're lost souls.
Democrats remain locked in, demanding extensions to Affordable Care Act tax credits in exchange for their support to reopen the government. They say they're open to negotiate, but accuse Republicans of refusing to come to the table ahead of another key deadline.
November 1st is around the corner. Families are going to have to pick their insurance policies then. It's a crisis, and it needs to be addressed immediately. Trump keeps trying to say this healthcare crisis can wait. House Republicans say we can do it later. That's BS. When they say later, they mean never.
Many Republicans believe there's a time and place for those negotiations.
We can't really get to that negotiation until the government opens. Democrats are trying to have that negotiation while then using the government shutdown as leverage. I think that's a mistake.
Mike and Eva, there are some things that states are doing to mitigate the impact of these federal SNAP dollars running dry. Virginia, for example, has declared a state of emergency to try and free up some emergency dollars to help cover that cost. Other states are looking at certain state-level programs that they can cut to supply additional dollars for SNAP as well. Reporting live on Capitol Hill for Erie News Now, I'm Brendan Scanlon. Mike, Eva, back to you.